Any question? Thank you, Mel. Thank you.
Dr. Surur was talking about the patient that you censor the patient in many countries. Can you give any example of that? Yes. How you do that?
Yeah, this is a very good question. Yes, because sometimes when you look for what is the most appropriate treatment for a patient, you have to weigh your pros and cons. And sometimes cost effectiveness plays a major role in the choice of the treatment for your patient. One example of this, you mentioned, say, contraception. If you have a patient who can afford to buy the most recent pills of contraception, which cost a lot of money, at least in my own country, Egypt, then she can have these tablets. But if you have the patients who cannot afford to buy monthly, on a monthly basis, these contraceptive tablets, which represent more than half the salary of her husband per month, so you will have to think about inserting IUD in her or prescribing for her the other contraceptive pills which are of a lower cost. I hope this example clarifies it.
Yes.
Thank you.
Maybe if I can add one other example. When you talk, for example, about care at the time of the delivery, it's very important to understand the cultural dimension of it. So in many parts of the world, the indigenous community, for example, has very different cultural beliefs and practices for how, for example, they would like women to deliver. They would like maybe in some part of the Latin America to deliver standing. So understanding those preferences and adjusting the service, and especially having the interface, the healthcare providers that provide that care that understands, is very, very important.
Thank you. Dr. Riley,
when a woman becomes pregnant, it is a joyous event. But if at the same time, as she seeks medical care, she discovers that she's HIV positive, it can become a time of fear, a time of abandonment, a time of separation from loved ones. It's a particularly vulnerable point in a woman's life to be faced with both major life events. And this is happening every day. And what we look to FIGO for is not only the compassion and understanding that has to benefit each patient, but also bringing in other professional cadres and semi-professional. One of the things we've discovered is women who are HIV positive who have recently delivered can provide counseling, support, information to women who are about to deliver. We call these mentor mothers. And we look to FIGO to help legitimize these semi-professional cadres as part of healthcare delivery. Not everyone needs to have a medical degree to play a role in what is very difficult circumstances for many women.
thank you. Please.
Let me just add something which I believe we also do with FIGO, but which we look to expanding going forward. That is looking at a life cycle approach to the women's life. And currently we're working with FIGO to do adolescent sexual reproductive health services. So ensuring that we can provide them with appropriate sexuality education, making sure that they have information about themselves, about their bodies, and empowering them to be able to make choices about their lives. Very important. The second, which is an emerging concept going forward, is the issue of elderly women. Today, we have about something close to almost 8% of our population globally above the age of 60. In 10 years' time, we'll have 10% of the population, about 1 billion of the world being aged over 60. By 2050, there'll be 2 billion. Half of them, in fact, more than half of them will be women. Because at 60, for every 100 women, there are 84 men. And we have to deal with the issues of chronic diseases in those women. And I think that, we look to FIGO and ensuring that working with FIGO, we can ensure that we can provide the services for those women. But I think preventing diseases in the elderly is probably the most important. And that is why what we do with FIGO currently with adolescents and ensuring that they can, for an example, ensure that they have lifestyles which prevent disease going forward will be very important. And education is an important part of that. Being able to access, for an example, vaccination against the HPV virus is one which is an important thing that we look to FIGO to work.
Thank you. Please.
Yeah. Well, I think one big advantage of this press conference, I'm going to get a lot of grants from you and the organization. One more point, actually, also, we work very closely with UNFPA, and that's the overcoming the brick walls for the acceptability and advocacy and the implementation of reproductive sexual health service. And that is the misconception about some religion concerning reproductive and sexual health. And we work very closely on this by producing the credible data and providing the credible information for the various religious leaders from the various countries, and we discuss with them the implication of the too early pregnancy, too close pregnancy, too many pregnancies, too late pregnancies, and what is the impact of these on the maternal and child health, and how maternal mortality in some countries like Egypt is 10 times the maternal mortality of a country like Italy, or the maternal mortality in southern Sudan is 100 times more than the maternal mortality in some other countries. And we found the religious leaders, actually, if you provide them with the credible information, they are very, very supportive to your program. And this is important, particularly in countries where you have a very high rate of illiteracy. And people just listen to what the imam or the sheikh says in the mosque or in the street or in the community, and they don't have access to information. And I think this helped us a lot in the propagation of family planning program, reproductive sexual health, and dispelling misconception also for immunization of children. A few years ago, we have had problem of immunization in Nigeria, I believe, in South and some of the African countries, and we had to send people who are religious leaders, well informed, to talk to the religious leaders in those countries and dispel misconception about religion and immunization of children, and that really markedly improved the immunization program with UNICEF. Thank you.
Maybe just to build on the comments that Professor Babatunde made on the elderly, and because I see that the professional association have a critical role on this. We are seeing in the world an incredible epidemiological and demographic transition, as he has highlighted. And in the case of women's health, for example, we are seeing that as we are successful in reducing maternal deaths, then what we're doing is progressively we are shifting illnesses and deaths for women at the later part of their life, maybe beyond their reproductive time. And these illnesses and deaths are related to illnesses that are very known and are scourged, for example, in countries like here, in Italy, for example, breast cancer is becoming one of the key killers, even in countries that unfortunately, because of their socioeconomic conditions, are much less equipped to deal with breast cancer, with cervical cancer. Many countries we don't have a registry, cancer registry, so we don't know what the real prevalence is, or the incidence of new cases. There is no capacity from the healthcare professionals to provide the treatment. I think in these next 10, 20 years, the healthcare professionals have an incredible role to play to say, how can we transform the quality of care that is being provided to women as they access services in the countries with the least capacity, to be equipped to deal also with these scourge like cancers that is becoming an increasing priority.